Today's National Fentanyl Awareness Day, and we are continuing our morning-long discussion, all 5 hours of Great Day, on this fentanyl crisis here in our area.
Right now, we have Dr. Trinidad Solis from the Fresno County Department of Public Health joining us. Good morning, Doctor. Thank you for your time and expertise. Tell us the difference between prescription-grade fentanyl that's from a doctor and the illegal fentanyl.
Great. Well, it's a pleasure to be here this morning with you all. And that's a great question. So prescription fentanyl is a synthetic type of fentanyl that doctors prescribe to patients to treat severe pain. So usually we prescribe it for conditions such as after someone's had major surgery or cancer. Alternatively, illicit-made fentanyl is when fentanyl is manufactured illegally and it's distributed in the drug market. What we're finding is that fentanyl is being repackaged and made to look like prescription opioid pills. It's being mixed with illegal drugs such as heroin and meth. And so it's very unforgiving, fentanyl, because a small amount can be lethal. And that's really what we want the public to know, that just be aware that it can be in a pill that looks like a common prescription drug. And I really want to advise the public to only take medication that is prescribed to you by your doctor and that you can pick up from the pharmacy.
Is the overdose of fentanyl or a fentanyl-laced pill take a long time, or is it something that happens quick, and what does it look like? How do we know?
Yeah, so a fentanyl overdose, usually the symptoms and signs that we see is that, for example, the pupils, which is a small center part of the eye, gets really constricted, very small. And people can have labored, slow breathing, or sometimes their breathing can stop completely. And other times the skin can get cold and clammy. So those are some signs that we look for.
Okay. Well, if somebody sees that, if they see somebody going through it, what do they do?
Yeah, so if someone sees someone that's suspecting of having an overdose, first you want to check if they're conscious. Can they wake up? You can call their name if you know them. You can rub the middle of their chest and see if they wake up. But if they don't, call 911. This is an emergency. Minutes matter because when someone is overdosing, there's lack of oxygen going to their vital organs, their brain and their heart, which can lead to cardiac arrest. So very important. And then if you have naloxone or Narcan available, use it.
All right, so let us know, what are those two drugs?
Yeah, so naloxone, which is also known as Narcan, is a medication that helps reverse the effects of opioids, and it works in minutes. It's very quick. So what happens is, so this medication, it comes in different forms, but this is one example where it comes in a plunger, in a spray. And it works because it quickly knocks off the opioids off the receptors and can reverse an overdose. So
and that goes right in the nose?
Yeah, so the plunger, the medication is in this spray here, this plunger, and so you press the plunger in the nasal area, and then, again, as I mentioned, call 911, minutes matter. And if the person doesn't wake up in 2 minutes, there's actually another dose that you can give on the other side of the nostril and you spray. And again, so help should be on the way, but minutes matter. So I just want to emphasize that this medication is for emergency use only if someone you suspect is having an overdose. And even let's say it wasn't due to opioids, it's still safe to use. So if you're not sure if they're overdosing from opioids or not, it's better to be safe and you can use it.
How do you get that? Is it prescribed by a doctor, or do you have to get it at a certain location?
Well, unfortunately, because fentanyl overdoses are becoming much more common these days, we want to increase the access to Narcan. And so what we do is here at the Fresno County Health Department, we're giving them away for free. So we're at 1221 Fulton Street, and minimal questions asked, and you can come and pick one up. We also have programs at Community Regional Medical Center's emergency room called the Bridge Program, and also Clovis Emergency Room Hospital, where, again, minimal questions asked, you can get one. And I want to emphasize that this medication is for emergencies, overdoses, but we have other medications these days to help individuals that want help with addiction, like recovery and treatment. So I just want to say, if you're out there and have questions and want treatment, as physicians, we're here to help, so please reach out.
There is help out there.
Yes, there's great, exactly.
All right, Dr. Solis, thank you very much.
Great, thank you.
Eye-opening information.
Thanks.
So if you or someone you know needs help, whether it's mental health services, substance use disorder services, call this phone number, 1-800-654-3939. 837. A real person will answer your call no matter what time you call and talk to you right then and there.